What to do for hemophilia emergencies? Imagine suddenly bleeding heavily from a cut or feeling intense pain in your joints without warning. If you or someone you know has hemophilia, knowing what to do can make a big difference. Hemophilia is a hereditary disorder where the blood lacks certain clotting factors, making bleeding harder to stop. During emergencies, quick action is essential to prevent serious problems or even life-threatening situations. The first step is to assess the situation quickly. If someone with hemophilia shows signs of bleeding, they need urgent medical attention. Call emergency services immediately. While waiting, keep the person calm and still to prevent worsening bleeding. Do not move them unnecessarily if they have a head, neck, or back injury. Next, focus on stopping the bleeding. If you suspect bleeding, do not wait for tests. Administer clotting factor concentrates right away. These are special medications that replace the missing clotting factors. The goal is to raise the clotting factor level to 100% for major bleeds. This treatment can be given at home if you have been trained or at a medical facility. Always trust the patient or caregiver's report about bleeding. They usually know their patterns and how much medication they need. For joint bleeds, early signs include tingling, pain, or limited movement. Rest the joint, apply ice wrapped in a cloth, and elevate it. For nosebleeds, pinch the nostrils firmly for 15 minutes, tilt the head slightly forward, and use clotting factor if available. Moisturizing the inside of the nose with Vaseline can prevent rebleeding. In cases of serious bleeding in the head, neck, abdomen, or deep muscles, do not delay. These are life-threatening and requiring immediate high-dose clotting factor treatment and urgent medical care. If bleeding is from a deep cut or fracture, apply pressure with a clean cloth and keep the person still. Do not try to remove objects embedded in wounds. Monitoring is also important. Watch for signs of internal bleeding like abdominal pain, vomiting blood, or neurological changes such as confusion or weakness. Immobilize affected limbs if needed and use crutches or splints for joint injuries. Contact the person's hemophilia specialist or nearest treatment center for guidance. If you cannot reach them, follow established emergency protocols. Administer the recommended doses of clotting factor based on the severity of bleeding and weight of the person. Educate patients and families on how to recognize early signs of bleeding and how to administer clotting factor at home if trained. Keep emergency supplies ready, including clotting factor concentrates, ice packs, and contact information for healthcare providers. Remember, quick and correct responses can prevent complications and save lives. Always stay calm, act fast, and seek professional help when needed. Hemophilia emergencies requiring immediate attention, but with proper knowledge, you can make a real difference.